been told that mobility of your joints is important, but from your ankle to your neck to your back, it's hard to know where to begin. Well, you're in luck. Let us show you our favorite mobility exercises for those pesky aches and pains today. Prehab, welcome back to the channel. Dr. Lauren Linus, and today let's talk about what mobility exercises you can be doing to help alleviate your knee pain, low back pain, neck pain, and that pesky rhomboid and mid-back pain we often find ourselves getting. Now, before we get into it, let's talk about why mobility of our joints is so key to a healthy body. When we look at the definition of mobility, it's how we move our body through space with control and strength. Having mobility of our joints is important because it allows us to continue to do things like stand up from the couch, bend down to tie a shoe, reach to put a dish away in an overhead cabinet. Right? Moving our joints helps us to continue to do these types of activities and also helps to keep our joints healthy. When we move our joints, we encourage the circulation of something that we call synovial fluid, which serves as a lubrication to our joints and helps to keep these joints moving. Working on mobility also has the added bonus of strengthening the muscles that assist with this motion through a bigger range. For example, if I have tightness in my lat and lack mobility through my shoulder joint, it's going to limit how my muscles assist with moving my arm overhead. Now, if I work on that mobility, then the muscles that assist with overhead flexion, such as my anterior delt and pec major, get to work through a bigger range, and then they get to get stronger through that range. So, what are some mobility-based exercises that you can perform for that knee pain, that low back pain, neck pain, and mid-back pain? Well, let me show you. Okay, knee pain first. The knee joint flexes and extends, but there is also some tibial rotation that occurs in our knee. To help assist with regaining knee flexion movement or bending the knee, try an exercise such as this while adding the towel to assist with joint gapping. This can help to provide your joint with just a bit more room to move. Tibial rotation plays a role in our ability to extend or straighten your knee due to something that we call the screw home mechanism. During the last 20 to 30 degrees of knee extension, the tibia, or our shin bone, actually rotates to allow us to fully straighten our knee, something that we call terminal knee extension. And this is one of our favorite exercises to work on that tibial rotation. All right, low back mobility. When we talk about low back mobility, we also want to look at hip mobility as well. The low back or lumbar spine is made up of 5 lumbar vertebrae and has close relations with the pelvis and the sacroiliac joint. Some studies have shown that lack of mobility in the hips can lead to increased low back discomfort, but more research is needed. Regardless, we need to recognize that there's a close relationship between the hip joint and the low back. To work on hip mobility, a favorite exercise of ours is this one. It allows us to control our movement through hip internal rotation and external rotation. To involve the low back further, we can try something like a pigeon pose with a bit of hip extension added in. Here, we will get into the pigeon pose position with our hip in external rotation under us and a slight flexion or rounding of the back. We can then add in a bit of hip extension to that leg that is straight to engage the glutes and posterior chain, and this even will give a little bit of a stretch to the hip flexors on the front of that leg. Neck pain, something that many of us have dealt with in the past and I'm actually currently working on, but I'm feeling better. I've been doing my physical therapy. Just like how our joints in our body love mobility, so do our nerves. And in our neck, we have many nerves that originate from the cervical spine and travel down our upper extremities to the hands. When looking for a mobility exercise for the neck, I like this one because it does a little bit of everything. We work on neck mobility and nerve mobility as seen here. To begin this exercise, you want to start by depressing your shoulder blades and thinking of spreading those hands out to place some tension on those nerves. You are always in control of this stretch, so depress and reach with what feels comfortable for you. Then in this position, we can begin to gently rotate our neck in circles to work on that cervical mobility while also introducing some healthy nerve mobility as well. Lastly, let's chat through that pesky mid-back pain we get right between our shoulder blades that we just cannot seem to get rid of. Oftentimes, the rhomboid muscle is made culprit in this case, and while at times it may be, more often than not, it's actually poor mobility through our mid-back. So let's do a quick screen to see where we are at. A lot of times we have limitations when we're in this all-4 position with rotation. So let's get into the all-4 position, and we're gonna lock out our lumbar spine by sending our hips back toward our heels. From here, take one hand and reach behind your back towards the small of your back. And then in this position, attempt to rotate your arm up towards the ceiling as far as comfortable while letting your eyes follow your hands. Take note of how this feels and then repeat on the other side. If one side feels stiffer, let's work on that. Typically, the side that you feel more limited with rotation on is the side that you may notice that nagging pain and discomfort. Now, it's normal to have asymmetries in our body. However, asymmetries that are greater than about a 10% difference, this is something that we want to keep our eye on. And if you're noticing a significant difference here side to side, definitely give this exercise a try. When looking at thoracic rotation side to side, this assessment can actually become the exercise. So it's worth trying about 8 to 10 on each side here to see which side feels more limited. Again, allow your eyes to follow your hands as you're rotating up, and then push through that planted elbow or hand to make sure we get a little bit of muscle activation on that side. From here, we can then go into a thread the needle type of exercise as we reach under our arm and then rotate back. Same drill, reach under on the opposite side and then return to that starting position. Focusing on this mobility once, if not twice a day, can make a serious change in that rhomboid pain that you may have been experiencing. Okay, so let's hit you all with the major takeaways. First, mobility is important, but what is even more important is understanding why we need to be doing certain mobility drills in regards to preventing injury and decreasing pain. Asymmetries in mobility and how our body moves are normal, but if the difference is more than 10%, we may want to take a closer peek and see if this could be the culprit for any pain or discomfort we are having. Remember, a moving body is a healthy body, so never neglect the role that mobility, as well as strengthening, plays in your rehab routine. Until next time, Prehab, happy moving.
Hey, did you like this video? If you did, you should definitely check out the Prehab app. It includes all of our programs, a brand new workout library, and tons more videos like the one you saw today. Check it out by clicking on this link. You get a free trial. Take control of your health today.